I am just getting older. That's probably what you tell yourself when your hands will go numb after a long day at the desk. We all do it, and we explain away discomfort with logic. We can say it's just stress. I've been sitting for too long. Not a big deal. But what if your body isn't just complaining? What if your body is trying to warn you about something bigger? So if you or someone that you know has ever brushed off these symptoms, watch closely. Because today I am going to reveal a shocking sign of rheumatoid arthritis that hardly anyone talks about. And no, it's not joint pain. Yes, many of us doctors, when we think about rheumatoid arthritis, we imagine what comes with a big entrance that will cause big, red, painful joints in the hands, feet, or knees. And while this is the most common way of presenting, there are some patients that do not present with joint pain at first. Now, let me introduce you to a true patient story. Julia was a 40-year-old lady. She was a software engineer who used her hands to work every day. But she also loved gardening. So one morning, she woke up and she noticed that both of her hands were tingling and they were numb. She started to shake them, move them, and in a few hours, she started to feel better. And that tingling and numbness disappeared. She thought maybe she didn't sleep right. Maybe she typed too much in the previous day. The next morning, the same thing. Her hands were numb and tingling, and it took longer to get rid of this feeling. In a few weeks, her hands started to be painful, and the numbness became a problem that was causing her to wake up in the middle of the night. It was time to see her doctor. But after one short 10-minute visit with her PCP, she received a diagnosis of carpal tunnel syndrome, and she was prescribed to wear some night splints and maybe take some ibuprofen. It made sense because she typed a lot for work. But after 2 weeks of wearing the splints, she did not see any improvement, but rather more pain, more swelling, and more numbness. And then slowly she noticed that she was extremely tired. Her fingers were so swollen to the point that she could not even wear the rings. But when she called her PCP, she just received a referral to a hand surgeon. And the hand surgeon gave her a few steroid injections in the wrist, and off the door she was. Julia called her PCP again, who this time referred her to a rheumatologist. But when she started to call rheumatologists in her area, no one was available. No one was taking her insurance, or she was supposed to wait for 6 months. And Julia was in pain. Her hands were swollen. She had tingling and numbness, and she was right at the point that she could not use her hands to do her job. And that is why she started to look for a rheumatologist online, and that's how she found us at Rheumatologist on Call. In less than 1 week, we were able to see her, get her a diagnosis, start her on a treatment, and help her feel better. But now you might wonder, what was happening to Julia? Julia was showing an early sign of rheumatoid arthritis. Now, when you experience tingling and numbness in the hands, especially in the thumb, the index, and the middle fingers, that's a sign of the median nerve being affected. And we call this carpal tunnel syndrome. And usually the carpal tunnel syndrome happens when the median nerves is entrapped or compressed in the wrist area. Now, most people who overuse their hands for typing or using vibrating tools, for example, will experience tingling and numbness in the hands or in the hand that they use the most. Now, here it is what it gets interesting. Carpal tunnel syndrome in one hand is very common in the general population, but carpal tunnel syndrome affecting both hands is very rare. And in my opinion, there are only 4 conditions that will cause carpal tunnel syndrome in both hands at the same time. Number 1, severe diabetes. Number 2, severe hypothyroidism or low thyroid function. Number 3 is pregnancy, and number 4 is rheumatoid arthritis. Yes, rheumatoid arthritis. Julia's problem was not her excessive typing, as you see, or excessive gardening, which was causing her carpal tunnel syndrome in both hands. It was actually the new onset of rheumatoid arthritis. Now, let me explain to you why carpal tunnel syndrome is happening in patients with rheumatoid arthritis. The wrist is made up of several small bones, which are arranged in two rows with strong ligaments holding them together. Now, running through the middle of the wrist on the palm side, there is a narrow channel that we call the carpal tunnel. And this tunnel acts like the hallway containing the median nerves and several tendons that control the finger movement. The roof of this tunnel is formed by a strong ligament, while the floor and the sides are made of the wrist bones. In people with rheumatoid arthritis, the joint lining, which is called the synovium, becomes very thick and inflamed. And then there is extra fluid and swollen tissue which will take up the space inside the wrist, especially near the carpal tunnel. Sometimes the tendon running through the tunnel also become inflamed. Because the carpal tunnel is such a tight space, even a little swelling can squeeze the median nerve inside. And this pressure will lead to those symptoms of the carpal tunnel syndrome, the tingling, the numbness, the weakness, and even pain in your hands and in your fingers. But why is this important to know? Because carpal tunnel syndrome is often the first noticeable symptom in some patients with rheumatoid arthritis. And many times it's misdiagnosed as isolated carpal tunnel syndrome. I have seen many patients in this situation, misdiagnosed. So if you share such an experience, please leave me a comment in the comments below and tell others about your story. And now if you think that this content helps you or someone that you know, please subscribe or share it with someone that might need this information. Because let me tell you, in my many years of being a rheumatologist, I have seen many patients who were misdiagnosed with carpal tunnel syndrome, patients who got multiple steroid injections and even multiple surgeries before someone realized that their carpal tunnel syndrome was a sign of autoimmune disease, a sign of rheumatoid arthritis. Because rheumatoid arthritis is more than carpal tunnel syndrome, let me give you a little bit more information about other common signs of rheumatoid arthritis. So if you're watching my channel, you know that I'm passionate about rheumatoid arthritis, and I have educated people all over the world about this disease. I even publish a book that you can find on Amazon.com. This is called Thriving with Rheumatoid Arthritis. Now, one common sign that I see in many of my rheumatoid arthritis patients is fatigue, exhaustion, feeling like you're walking through the mud. And this feeling of fatigue can seriously impact your daily life, your mood, and your ability to focus. And this intense fatigue is directly a result of your body using huge amounts of energy to deal with the inflammation happening. Then joint pain, redness, swelling. But what is specific for people with rheumatoid arthritis is that most of the time, both hands, both feet, both knees, both shoulders are painful and swollen at the same time. There is this symmetric and bilateral pattern that is specific to this disease. Most of my patients will describe severe morning stiffness that will last more than an hour, but that will improve gradually over the course of the day with movement. But also many of my patients will describe difficulties doing things like everyday tasks that they never had problems to do before this disease started. Things like opening a Ziploc bag, or opening a water bottle, or buttoning the shirt or a zipper. Or they can even have issues with their handwriting. People with new onset rheumatoid arthritis will also complain of severe dry eyes, dry mouth, because inflammation does not stick only to the joints. It can affect your lacrimal glands, your salivary glands, and slowly but surely will spread to your lungs and your heart if you don't treat it. You may even develop pinpoint rashes. Then you may lose weight without even trying, or you may develop fevers every night, or you might just feel that you have the flu, but you don't. And all these signs are connected with rheumatoid arthritis. But why is it important to recognize rheumatoid arthritis early? You might think that if rheumatoid arthritis just causes carpal tunnel syndrome, I might deal with some tingling and numbness and I can go on with my life. And that might be true, but it is very wrong. Rheumatoid arthritis is a systemic disease that will affect your joints, but could also potentially affect other organs. And you may end up with heart disease, eye disease, or lung disease. I'm not telling all of this to scare you, but rather to educate you to make an informed decision. Getting an early diagnosis and starting treatment for rheumatoid arthritis can dramatically change the course of the disease and can make a huge difference in the long-term outcome. The first few months to a couple of years of rheumatoid arthritis are often called the window of opportunity. During this early phase, starting proper treatment will prevent or delay permanent joint damage. Plus, as I mentioned, it will reduce the risk for complications like serious health problems, heart attacks, heart failure, hardening of the arteries, or lung disease, or even osteoporosis. With what we have today as treatments, reaching remission, which is a state where your disease activity is very low or it's gone, it's a realistic goal for many people with rheumatoid arthritis, especially for those that start treatment early. Now, let's come back to Julia's case. Remember that sudden, unexplained carpal tunnel in both of her hands, her severe fatigue, and her trouble to use her hands for everyday tasks. These signs were initially brushed off. Julia suffered, but she was persistent, and then she became her own advocate. She found what we call unconventional way of getting medical care when she needed the most. And while she was in Texas and I was in California, she got all her rheumatoid arthritis treatments via telemedicine. And today Julia is doing great with no more pain, no more tingling, no more numbness, and no more fatigue. And now that you know about this shocking sign of rheumatoid arthritis, if you want to avoid suffering in pain, distress, and unknown, then watch this next video to learn about the most common tests that we do to get to the diagnosis of rheumatoid arthritis.